Hey y'all, hey, it is Dr. Cherry, and I am here with Chapter 5 of Crisis Assessment, Intervention, and Prevention, Jackson, Cherry, and Erford, the third edition. Chapter 5 is Loss, Grief, and Bereavement. All right, so we're going to jump right in, and the first thing we're going to talk about is how the DSM-5 talks about persistent complex bereavement disorder. So the persistent complex bereavement disorder in the DSM-5 took the place of what we formerly known as complicated grief. And so there's a few criteria that are listed here. The individual experienced the death of someone with whom he or she had a close relationship. Since the death, at least one of the following symptoms has been persistent for more than 12 months. And so it lists these symptoms. There's a reactive distress to the death. There's a social identity disruption. Then there's some diagnostic features. And usually a lot of these, the criteria is that they've lasted for at least 12 months. And so you definitely want to make sure that you look at the DSM-5, the persistent complex bereavement disorder. All right. This chapter, unfortunately, is something that many of us are going to have to deal with at some point in our careers, especially if we haven't dealt with it in our own personal lives. So once again, like I just mentioned, DSM-5 listed as persistent complex bereavement disorder, formerly known as complicated grief. And it's usually assigned to individuals who experience an unusually disabling or prolonged response to bereavement. Once again, I already mentioned, it's formerly known as complicated grief disorder. It's the persistent complex bereavement disorder that causes sufferers to feel extreme yearning for a deceased loved one, usually over a prolonged period, and that prolonged period is usually over 12 months. And so when we're looking at how we deal with grief, there's quite a few approaches that come to mind, and we're going to look at a few of them. Lindemann in 1944, Lindemann conducted these, in 1942, Lindemann conducted these approaches. There was a 1942 Coconut Grove nightclub fire, and he did these interviews on the survivors and those who had lost someone in the fire. And he came up with 3 tasks of mourners. And the first task is they had to be emancipation from the bond of the deceased. So it had to be a form of emancipation. They had to let go of that bond from the deceased. That was task number 1, emancipation. Number 2, there had to be a readjustment to life in which the deceased is missing. So there had to be some form of readjustment. What is my new normal, right? I got to let go of this bond and I have to come up with a new normal. And then number 3, formation of new relationships. I have to recognize that that relationship is now gone and I have to form new relationships. And so Lindemann, he believed that grief was resolved when the mourner severed the relationship with the deceased and moved on to form new attachments. And so that's why you have these 3 tasks: the emancipation, the readjustment, and the formation. And so a lot of people have kind of moved on from that, because I think in this day and time, we all know and believe that even when a loved one is passed on, we still maintain some form of relationship with that person if you choose to. Kubler-Ross, she's one of the more prominent ones, and although hers has changed over time, we're going to look at how hers started. And so she's known for a couple of her works. The main 2 are On Death and Dying and Death, the Final Stages of Growth. 1960, she was created with this death awareness movement. And she focused mainly on terminally ill patients. So her format was not necessarily geared towards those that are in crisis. It was mainly geared towards those that were terminally ill. And so if you've had a chance to say your goodbye, if somebody was dying from cancer or something like that. And so she had these 5 stages of sequential dying and grief. So these stages were very sequential. They went in order. And the first stage was denial. You know, I just can't believe this is happening to me. The second one is rage and anger. You know, God, why is this happening to me? You know, I don't deserve this. The third one is bargaining. You know, Lord, if you'll just take this from me, I'll be a better person. And the last one is acceptance, that, you know, this is the end. I'm going to make sure that my family and everyone knows I love them. And so it went from the sequential order of dying and grief, the sequential stages, and it adapted into more of a spiral, moving forward and circling back kind of thing. Because she recognized that even if you get to bargaining, you might still go back to denial. And if you get to rage and anger, you might still go forward to depression. And if you get to acceptance, you may still go back to anger. And so it's this cyclical circling back thing that just constantly happens. And once again, it doesn't apply to catastrophic deaths, because this was mainly geared towards individuals who were going to go through this period of dying. Worden, on the other hand, Worden proposed a task model of grieving, and he wanted to empower the bereaved. And he wanted to empower the bereaved to accomplish 4 tasks. And so the first task was acceptance. Wants to empower the bereaved to accept the loss, right? And so even after a period of disbelief, just kind of accept the loss. And so this is mainly for grief, not the dying part. So this is more like for crisis. 1, accept the loss. 2, experience the pain. He, you know, was saying, feel it, sit in it, be in it, live in it, experience the pain. The third task was adjustment. Adjust to the environment without the person. What is life like now without this person in your life? How do you adjust? Again, like I said earlier, what is your new normal? Accept the loss, experience the pain, which is probably going to be the hardest task. Adjust to an environment without the person. And then 4, reinvest emotional energy into other relationships. And so it's almost like a move on. Not necessarily forgetting the person, but take that same energy and put it into other relationships, not necessarily other people, but other relationships, whether it's work relationship, whether it's, you know, something that you're doing, a task. But he really wanted to encourage or empower the bereaved to take charge of their grief. And I really like Worden's task model of grieving. And so once again, I want you to remember these 4 tasks: acceptance, accept that this has happened, accept this loss. Experience the pain, which is probably the hardest part. How do I sit in it? Most people who are going through the grieving process have a really hard time experiencing the pain. Adjust to the environment without the person. That can be challenging. And then reinvest that emotional energy into other relationships. Okay. Second. All right. And then you have Bowlby. And so Bowlby had these 5 conditions. I'm trying to see where they are in your textbook so you guys can follow along. Okay, that's on page 118 if you guys are following along with the textbook. And so Bowlby, he did his research in 1980, and he had these 5 conditions that affect the course of grieving. And so these 5 conditions, and these were mainly for crisis intervention. And so the first one is 1, the role of the person who died, right? So what was that role of that person in your life? You know, if they were your spouse, and you all had been married, you know, 30 years, you know, that role is gone. Your provider, your protector, your best friend is gone. So that role of that person who died, if they were your father or your mother and they were the one that you leaned on and depended on for everything, is gone. If they were your child and, you know, you gave birth to this person and you brought them into this world, what was the role of the person who died? And that's really significant for a lot of people who are struggling with the grief process, because we tend to minimize sometimes how significant the person who passed away was. That also happens when we deal with disenfranchised grief. You know, if it's somebody who their grief isn't recognized, then that role of that person, you know, is often minimized. Excuse me, 1 second, you all. All right, sorry about that. I am back. All right. So that was the first condition to affect the grieving. Number two, the age and gender of the bereaved person. And so age is really significant, because if the person was, you know, a 15-year-old, you know, girl, you know, and, you know, when you think about, you know, I'll never have grandchildren because my 15-year-old daughter just died and she can't give me children. It's my only daughter. You know, if it was, you know, your 17-year-old son, you know, no one's going to carry on my legacy. He, you know, he was the boy, he carried on my legacy. You know, if it was my 90-year-old grandfather, you know, he was the, you know, patriarch of the family. You know, so the age and gender of the bereaved has a lot to do with it. If it was, you know, a 45-year-old breadwinner, you know, that means a lot. And the third condition is the cause and circumstances surrounding the death. That's really huge. And that's something I don't want you guys to minimize, the cause and circumstances surrounding the death. Because if the person died from, you know, natural causes in their sleep, that's probably a little bit easier to grapple with. It's going to be difficult to understand, and you're probably going to be upset with God. That's a little bit easier than, you know, someone getting shot or someone being murdered, or a DUI accident, or something that you feel could have been prevented, or you feel that they were taken from you. So the cause and circumstances has a lot to do with the third condition. Number four, the social and psychological circumstances. So the social and psychological circumstances affecting the bereaved at the time of the loss are huge. So, you know, was this person mentally challenged? And, you know, they got harmed because of their mental status, meaning did they get taken advantage of or something like that? And so those kind of things can't be minimized. And that's really important. Were they a social misfit, or were they a social status elite? And so all those play into the role of the person in your life, and, you know, the cause and circumstances, and then the social and psychological circumstances all kind of are interwoven together. And then the fifth condition is the personality of the bereaved. If the person was somebody who brought you joy, and you feel like that joy is gone, like you just can't laugh because that person was your laughter, that person was your sunshine, then it's going to be very difficult to find joy in life anymore. And so, you know, was that person the one who kept you on track? Was that person really strict and really disciplined? Was that person the one who kept you off drugs? Was that person the one who kept you grounded? Was that person the one who kept you close to God? So the personality of the bereaved. So all these are very interwoven, and it has a lot to do with who the person that is now deceased, who they are and who they were. And so Bowlby these conditions have a lot to do with the person that is gone. Okay. All right. So this one is really, really huge that I want you guys to pay attention to. Culturally speaking, grief, when it comes to different cultures, is not a one size fits all, right? And so what we do know is that all cultures grieve. We know that, right? It's how they display it and how they internalize it that's different. And tears, anger, depressed affect, disorganization, difficulty with everyday life, those things are common among anybody who grieves. However, other things are different. It really bothers me when I hear somebody say, well, they don't look like somebody who just lost a spouse, or they don't act like a parent who just lost a child. You can't lump everybody into the same category when talking about how someone should grieve. And so a lot of times people have different cultural differences, but even if we're the same culture, like you can't dictate how someone grieves, right? It's a very individual thing. You can't expect, you know, just because, you know, somebody's culture may be okay with crying and weeping, that if your client is part of that culture and that your client is internalizing it, that your client isn't grieving effectively. And so the best thing for a crisis counselor to do is to ask and not assume. Ask the client, can you tell me how you're dealing with this grief? Tell me how you're dealing with this. And tell me how you show or express your grief. Tell me how you would like to show or express your grief. What is preventing that? How can I help you with that? How have you seen others grieve? And, maybe, she saw her aunt climb into the casket and she said, well, I just never want to do that. Did you see that as a sign of weakness? I see my mama cry every day for her mom, and I never want to cry every day in front of my children. So what did you see that, challenged you? And so counselors should always ask the question and not assume. Don't just assume because someone's not wailing that they're not grieving. And I really want to get to this part. Help your client find meaning. What you don't want to do is say, well, at least they're not in pain anymore, and at least they're in a better place. But you still want to help them find meaning of the person's life. Help them find meaning of the person's life. And the last one is really important. Guilt is not always a part of loss. Not everybody who loses someone goes through any kind of guilt crisis. Guilt is not always a part of loss. Everybody who loses someone doesn't feel guilt. Now, guilt is common when you lose someone to suicide or a sudden death or unfinished business. Then it is kind of common, but it's not always a part of loss. So if a parent loses a child to suicide, that parent is probably going to be devastated, thinking, what did I not hear? What did I not pick up on? If there's some unfinished business between, you and someone that you love, and you always said, I'm going to call them, I'll call them tomorrow, or I'll call them when I get a chance, then that's where the guilt comes from. But guilt is not always a part of loss. So don't just assume that your client is feeling guilty about any kind of loss. Ask, don't assume, ask them, make sure to ask the question. Let the client help you as you help them. All right. Ambiguous loss and disenfranchised grief. This is challenging. Ambiguous loss and disenfranchised grief is challenging because this is usually dealing with unrecognized relationships, unrecognized grief, disenfranchised death. Unrecognized relationships are usually, fortunately, in this day and time, we're getting much better. So fortunately, we are getting much better in our current society. But there was a time that if you were in a same gender relationship, that it was an unrecognized relationship. And so, you weren't, considered the spouse because legally you weren't the spouse. And fortunately, that has changed. An unrecognized relationship, could be, a girlfriend. Even a fiance sometimes is an unrecognized relationship. Let me put this in here. A mistress is an unrecognized relationship. And so, this person may be, not that I condone breaking up a happy home, but, this person is still grieving. And as counselors, we're not there to judge, that she was involved or that person was involved with the married person. We're there to help this person get through the grief. Unrecognized grief. There's some grief that people don't recognize, and especially things like abortion and miscarriage, the loss of a pet. The loss of a pet is huge. I don't know if any of you guys have had pets as children, especially pets that were fortunate to grow up with. When those pets die, that's like trauma, and that's considered unrecognized grief because they're looking at you like, it was just a dog, it was just a cat, get over it. But it's unrecognized grief, and it's not fair. A stillbirth is considered unrecognized grief. And so you have these unrecognized relationships, this unrecognized grief, this disenfranchised death, and then you have this loss that is an experience. So it's a loss that's an experience, meaning the person isn't necessarily dead, but they're kidnapped and they're missing. Like somebody's been missing for 10 years, so there's no closure. A soldier missing in action, there's no closure because you don't know if that person is being tortured and alive. There's just this loss, and it's just empty loss because you have no closure and you don't know, and that's a really, really painful place to be in. Okay. All right. And so when you're in these places, your goal as a crisis counselor is to be the person that's going to help them get to a place of healing. And so you want to be the one who mediates them to interventions. And so first thing you should be aware is there's no time limit on grief. You cannot tell somebody that they should be okay in 2-3 months. Now, I just know we talked about, the complicated grief, and after 12 months, but what it's saying is after 12 months, we should be in a place where we can start living a normal life. But there should be no time limit in working through it. And that's the second point, work through. The part of grief counseling is us working through it, not we can never replace that person in somebody's life. No amount of counseling can replace that void. But what we can do is we can work through it. And one of the things we can do is what number 3 is the dynamics of the grieving process. You have to educate your client on these dynamics. Educate your client that grief is normal. Let's start there. Please hear me. Grief is normal. Grief is not linear. It's not a straight line. It's not A, B, and C. It's going to be A, G, F, Q, X, M, Y. Like, grief is going to be all over the place. And if you don't believe me, either you're going to experience it or you're going to see a client go through it. It is not a linear process. It will be all over the place. And unfortunately, for people who have not embraced the process, you will not see it when it hits. It comes in waves. It just comes in waves. And the main goal of your intervention is to restore meaning. Help the client restore meaning to their life, and help the client understand the meaning of the person that's gone, understand the meaning that they brought to this world. And so, you'll have your job is to have these intervention techniques, and they'll take time. They'll take time, but don't rush it, right? Don't rush it. And so one of the last things I want to talk about is the faith development theory, FDT, faith development theory. And so the faith development theory has 6 stages. And if you guys are following along in your textbook, this can be found on page 127. So the faith development theory has these stages. And these stages, stage 1 is the intuitive projective stage, right? It's this stage that is most often seen in childhood, this intuitive, and I put protective, but I apologize, I'm going to fix my slide. It should be projective stage. It's this intuitive, almost seen in childhood, ages 3 to 7. So the FDT stages are almost like the life cycle. And so it's here that fantasy and reality are intertwined and the imagination is powerful. And it's here that the person thinks about the deceased in these grandiose ways, right? And then so you have stage 2, this mythic or literal stage. And this is when a narrative is used to give meaning to life. And so in this mythic literal stage, you'll see the person telling stories about their loved ones and reciting these amazing stories. And I actually like stage 2 because you get to, this is where they're most comfortable because you get to hear them narrate the story of their loved one. Stage 3 is a synthetic conventional stage. Personal identity is formed at this stage. And it tends to be determined by the approval of others. So at this conventional stage, you're actually looking for your approval of their deceased, especially if they, like them or they, cared about them. And so for the faith development theory, you'll have stage 4, individuative, reflective stage. Stage 5 is the conjunctive stage, and stage 6 is the universalizing faith stage. And especially when you get to stage 6 and you get to look at the person as though that you believe, remember it's a faith development theory. So in stage 6, you get to believe that they are good all within themselves and that they are in a better place and that they are whole. And because of their life, then your life is better. And so you'll have all 6 of these faith development theory. All right. And the final thing I have for you for chapter 5 under the bereavement and grief is self-care. Ladies and gentlemen, if you are going to do any kind of grief counseling, you must engage in crisis counseling. You must yourself engage with a therapist and communicate with a therapist that you're trying to do this kind of grief counseling, and you might need your own therapy. That's a huge form of self-care when you are involved in therapy. Number two, you have to set healthy boundaries, meaning although you want to be there for the person that lost a loved one, you may not can be there every day at 3 o'clock in the morning. Let's set healthy boundaries. Supervision. Make sure you are engaging in supervision. Please, please, please make sure you are engaging in supervision, especially if you're going through, the process to become licensed, because that's where you can bounce off and you can tell your supervisor about how you're feeling with doing this grief counseling. And next, recognize transference and secondary vicarious trauma. When you recognize that you're experiencing, you're counseling someone and you're experiencing what they're going through, and you're taking it on, you got to recognize that transference. And and that secondary vicarious trauma, that is real. When you take this to become your own, and when you're now having nightmares and, you're now living this thing, you're taking it as your own, especially when you're doing it all the time, you got to do self-care. You got to take a break. Also, you're going to end up in compassion fatigue. And compassion fatigue is pretty much a cute way of saying burnout. So you have to engage in self-care. And the number one way to engage in self-care is every therapist should have a therapist. You have to have a way where you can get some of that off of you. You can't hold all that in. I know we want to be strong for everybody. I know we want to be there for everybody, but you can't be there for everybody. You have to be there for you first, if nothing else. If nothing else, ladies and gentlemen, you have to be there for you first. Okay? All right, here we go. Have an amazing day. Blessings. Bye.